Welcome to Plant Your Seed. I'm your host, Fred Ferris. On each episode, we share stories of how ordinary people have transformed their lives. Each story is compassionate, each story is authentic, and each story is a transformation. Here are the stories of the people who are changing our world by transitioning to a plant-based diet. Today on Plant Your Seed, joining us from Florida, we have Dr. Monica Aggarwal. Dr. Aggarwal is an adjunct associate professor in the University of Florida's Division of Cardiovascular Medicine, where she conducts research on the impact of nutrition on chronic illness. Welcome, Monica.
Thank you so much. It's great to be here.
Thanks for being here on Plant Your Seed. There's so many questions that I have for you, but let's start with how and when did you transition to a plant-based diet?
So I've been a vegetarian since, actually, my parents are vegetarian. A lot of Indian Hindus, which is their culture and religion, are vegetarian. Not always, but a lot of the older generation is. So but when I was little, my parents, because I was born in America, felt like I needed to assimilate with the American culture. And so they decided to introduce us to animal products. So they took us to McDonald's when we were young to kind of teach us about meat because they figured we better learn how to eat it because everyone in America eats meat. Mm-hmm. Then when I was about 16, I stopped eating animal products again. Because for ethical reasons. Mm-hmm. And I became a strong environmentalist. It was about 10 years ago, maybe now almost 10 and a half, almost 11 years ago, where I became completely whole food plant-based.
Have you noticed any changes, both mentally or physically?
Yeah, I mean, I did that for my health. I was suffering from a rheumatologic illness with a lot of joint inflammation. And when I changed my diet, my symptoms completely resolved. And for 10 years, I've been off of all rheumatologic medications for 9.5, almost 10 years now.
Now, can you tell us what rheumatoid arthritis is?
Sure. It's a autoimmune disease where your body attacks itself. So autoimmune means your body's immune system attacks itself. And there are many autoimmune diseases, some of which are like inflammatory bowel disease, like Crohn's and ulcerative colitis, type 1 diabetes. These are all autoimmune diseases where your body sort of attacks part of its hyperactive immune system will then attack some part or facet of the body. In rheumatoid arthritis, the immune system becomes overactive and attacks the joints, and usually the small joints of the hands and feet, but also could be the larger joints over time.
I read where there is no cure for rheumatoid arthritis. Do you still suffer from it?
Yeah, I mean, I think that I will always have rheumatoid arthritis, but I'm not sure that there is a cure or not. That I'm not sure yet because I have not been able to cure myself. But I do think that you can put your illnesses into sort of a deep resolution or a deep treatment, or where there maybe it's always. I think you always have it'll always be there, but I'm not sure that. But it doesn't necessarily have to rear its ugly head. Now, when I got COVID and then the COVID vaccine, I did have my joints triggered again after 10 years. And that was very surprising. And that's all sort of gone away again, or primarily gone away. But I don't think it'll ever be, at least not yet. I haven't been able to cure the illness yet, but I certainly think that you can put it into remission.
Now, when you got rheumatoid arthritis, it was right after the birth of your third child?
About 4 months after, yes.
Were you nursing at the time?
I was.
How concerned were you as far as the medicines and prescriptions that the doctors were putting you on to treat your rheumatoid arthritis, how that would affect your baby?
It was horrible. So they actually told me I had to stop nursing. So within a week of my official diagnosis, they wanted me to stop nursing so I could get started on medications. My body was so inflamed and I had such abnormal markers that they were highly concerned that they wanted me on medication within a week of my diagnosis.
How did that make you feel?
It's a horrible experience. Anybody who's had that control taken away from them, in general, when illness takes away control, it's very sobering. It's ultimately the thing that hurts people the most is the lack of control over your body. But on top of that, the choice to nurse my child was taken away.
How did you learn about the microbiome and the impact on the immune system?
After I started healing from my illness and from with the medications, I met a woman who started talking to me about nutrition. And I was already vegetarian, and already felt like I was pretty healthy, but ironically I wasn't, because I was obviously sick. She started making me think about the things that you do in your life and your lifestyle that could impact you getting healthy. If you can trigger illness with bad lifestyle, then can you actually improve your illness with good lifestyle? So it made me start looking into nutrition and the impact of dairy, the role of animal products, the roles of refined sugars and processed foods. It made me start looking at how much sleep it plays a role. I've spent a lot of time thinking about stress and reading about stress, and then all of this sort of naturally led me to the gut biome. I mean, I've been aware and reading about and knowing about the gut biome for over 10 years. It's become a popular topic now, but it's been around for over 10 years where people have been talking about it and longer. And I spent a lot of time talking to and going to conferences and going around the country, kind of learning from different scientists about the gut and how the impact of the changing of the gut bugs and the flora and the concept of leaky gut. I met a great man named Alicio Fasano, who is a Harvard professor, and I spent a lot of time with him. And he is a very interesting man, working a lot in that space of leaky gut.
How can someone reset their body?
Well, that's a hard question to answer because it's so different for everybody. But I think that everybody has a certain level of resources and a certain level of demands in their body, and most of us have too many demands and things that deplete us, and not enough things that restore us. And so most of us are out of balance. This is why our first book was called Finding Balance. And we've changed the cover, we republished it and changed the name to Body on Fire, because we focused on inflammation, because inflammation is really the key. And that's why Body on Fire means your body's mad at you, and that's inflammation. But it's when you have too many demands and not enough resources. So for most of us, it's, lack of movement or lack of sleep, high levels of stress, poor nutrition. And when you kind of correct those things, and sometimes you have to throw the kitchen sink at it, you can potentially reset your body.
What is the first thing people can do to calm the inflammation and reduce the risk of illness?
Also not an easy answer because it's different for everybody. But I think the most important thing to do is to find your triggers, figure out the things that trigger your body and trigger inflammation in you. Most of the time it's poor diet, and it's a very good way to start, because in some ways it's the easiest just to start with diet. Sometimes it's harder to start with sleep or reducing stress. And sometimes just small changes in diet can make a huge impact, and that's very positive reinforcing, which can make people, which then can start people on that path to recovery.
What are some inflammatory foods to eliminate and some anti-inflammatory foods that we can add to our diets?
So if you just think about it in terms of broad categories, cutting out all your red meat is really important. Cutting out dairy, I think, is very important, and that's cow's milk dairy. And that's a good place to start, but also includes animal milk. If you can start there, that's a really good place to cut out. But also processed foods are highly inflammatory. Refined sugars are very inflammatory. So all those foods can be kind of removed, which is not easy. It takes time and patience, and it's okay to let it happen slowly or quickly. It doesn't have to be the same for every person. And then adding back a lot of foods that are fiber rich, natural probiotics. Those things are really, really important.
What is the first step for someone who believes that they have an autoimmune issue and have gone to dozens of doctors without a diagnosis?
Well, typically it requires a good rheumatologist if they have an autoimmune problem, or a good primary care doctor who's kind of looking at these symptoms. I mean, there's many people that have inflammation, and there are some inflammatory markers that can be tested in the blood that are not standard but could be ordered and are suggestive of inflammation. And then, like a standard primary care doctor, if you walk in and say, "Oh, I've just been tired, I just don't feel great," these are sort of non-specific symptoms that a lot of autoimmune patients have, may not check their thyroid, might not check their ESR, which is an inflammatory marker, or their CRP, which is an inflammatory marker. But those are good tests to order. And if they're high, that could suggest something's not happy.
What is it about autoimmune diseases that make them so difficult to pin down?
Because anything where the immune system is attacking the body, it's tricky because it could attack anything. And so for different people, it's different things. And so it is definitely, and not everybody has the same symptoms. We all manifest symptoms so differently that it's often hard to figure out and detect. And so much of the time people describe very non-specific symptoms. I just don't feel right. This joint bothers me, or I'm tired, or my back hurts all the time.
Mm-hmm.
A lot of times those are very non-specific symptoms, and they're harder to pinpoint as a doctor.
Are prebiotics and probiotics helpful?
It depends how you take them. Yeah, are they conceptually good for you? Yes. I mean, prebiotics feed the bacteria in your gut and help them nourish and strengthen the bugs. Probiotics are the bugs, so it gives you those good healthy bugs. But so much of the time, the probiotics that you get over the counter are full of a lot of junk, and a lot of the strains of the bacteria that are in these probiotics aren't tested. And studies have been done to look at these bottles, and they find that there's a lot of fluff in those. So those often probiotics are sort of plus minus. But there's so many natural probiotics out there, right, that give you, and those are those fermented foods. So eating fermented foods is really good for the gut flora, because they give you those gut bugs back. So why take a pill when you can eat the food?
What is it about sleep, movement, and the unstressed mind that is so important?
Well, sleep is for restoration, right? So when we sleep, we restore our bodies. So you need that time to recover. I know that. Just think about when you have a cold, you go to bed with a cold and you wake up and you don't have that cold, or it's better because you're immobile during that time, and your body has a chance to fight the infections or fight the illness. So sleep is one of the most important ways to restore your body, and people just forget it, or they spend so much time on their phone or their emails, or so busy, or they struggle with sleep, or they snore, and people don't get quality sleep. Movement is important because it keeps you trim, which is very important. It helps you dilate blood vessels, which is really important, and it helps you metabolize. It helps you break down all the unnecessary fats, and a fat in itself is highly inflammatory.
What is the first thing someone could do to reset their microbiome? Would it be fasting, an elimination diet? What should they do?
If somebody's trying to reset their gut, I usually tell them they should remove some of the big triggers, which is, red meat and dairy are really good ways to start. And of course, processed foods, but you could do that in step 2. And then adding back natural probiotics. So kimchi, sauerkraut, those kind of natural probiotics is a great place to start.
Now, I read that you instituted a new plant-based menu at the University of Florida Shands Hospital. How difficult was that to institute, and how is it going?
It was very difficult to institute in the sense that, change is hard, especially for a major center. But I think, with patients, things can change. I think when people understand what the great grand mission is, then they jump on board and on your team. I think it's important to understand where people come from. So much of the time when we try to impact change, people try to say that this is the way it has to be, period. But I think that that's the wrong way to do things. I think you have to do things kindly and calmly, and sort of show people your ways and why you think the way you do. And then people start changing. It did take us about a year before we were able to implement the diet. And overall, it went really well. It's a little harder now that I've transitioned away from the University of Florida, certainly, because sometimes it's just nice to have a champion. But they're still going very well. We published the data that showed that people ask for these meals, they like having them, and they're cost effective.
How can we get more nutrition on food as medicine in the medical curriculum?
That's a very tricky question, because we work on that at many of the committees that I work on. We work on that, and a lot of the medical schools have implemented nutrition curriculums, but unfortunately, they're not as well attended as the other topics because they're not on the boards. And so it's a bigger, deeper problem where we have to sort of tackle the medical boards to get them to start asking questions on nutrition. But slowly and slowly, many medical schools have included a prevention and nutrition program. For instance, University of Florida does a week. Some places do culinary kitchens. The problem is often these are electives and not everybody attends.
You also serve as the Chief Medical Officer of the not-for-profit Four Roots Farm. How do we improve food quality to improve human health?
So much of the fundamental problem with food now is that it's depleted of food quality. It's coming from different countries. 50% of the food that we eat now in America is not grown in America. And so we get so much from outside, and our farmers are going bankrupt every day because we don't support our farmers. And they struggle so much, but they are the fundamental foundation of food if we don't support our farmers. So there's so many issues with soil quality and pesticides and lack of diversity in our food. I mean, this is a huge topic in itself. And food, for instance, big time growers and big time farms and chains that have created these empires around food. They create 2 or 3 types of things. They create soybean, they create corn, one type of apple, one type of tomato. And so we're getting this very little diversity in the foods that we're eating. But having healthy, diverse foods is fundamental to having a healthy, diverse patient or person. And the problem is that we've lost diversity in our food. We've depleted our soils from microbes that are healthy, that help the plant fight infections. So then they don't build up, they don't become stronger. Then the food that we provide people becomes a suboptimal food. It's a huge area that needs to be tackled, is the lack of food quality in America and slowly around the world.
Now, going back to your story, when you developed rheumatoid arthritis, can you tell us about what happened? What were the symptoms?
Within a couple of weeks of my diagnosis, I had gone from being an active runner to being unable to move or climb upstairs. My knees were completely affected. My feet felt like I was cut. I was always stepping on glass. My shoulders were sore. All of my finger joints were sore. So very quickly, a rheumatoid patient will know that you can go very quickly from being totally normal to be totally inflamed. And none of the symptoms. At first, I thought, I did ignore it for a little while. I treated myself for Lyme disease because Lyme disease can present with these sort of migratory pains. But then over time, when it became very diffuse, there's no way to ignore that.
Now, as a doctor, what was going through your mind at that time? Here you are, a relatively healthy person, and all this stuff starts happening to you. What are you thinking?
Well, I think that you feel very sad by I was a new mother. I had 3 kids under 4 years old. I was a full-time cardiologist. I was thinking, like, what's happening? Like, how's this going to go for me? Like, it's just me, and me and my husband and these 3 kids. I got to raise these kids. And so that was really sobering. But then as a doctor, you think, gosh, like, do I really have this illness that's incurable, and that this is how this is going to go? Like, is that it? Like, this is very sobering. Are there no other options? There's no way to come off medications. That's really hard to understand.
What did you learn from that experience?
I think you learn how to be a better patient. You learn to be humble. You learn to honor the disease. You learn to honor that everybody's scared, and that you try to meet people where they are and try to help them along their course and along their path. I think so many doctors can be very judgmental. It's my way or the highway. And I think it's hard for a lot of doctors to understand where people are coming from. And maybe the best thing I've learned is that people just want hope, and they want to know that there's a path. And I think those are probably the biggest lessons I learned.
Now, when you go back to that decision to change your diet, what sticks out in your mind?
I think cutting out dairy was a big trigger for me. I was already vegetarian, so cutting out dairy and processed foods were probably the single two most important things I did in terms of dietary change.
Why was that?
Because those are highly inflammatory foods.
What exactly does that do to the body?
So when you eat processed foods, your gut bugs are totally different than the person that are low in fiber. Your gut bugs are totally different than a person who eats whole foods that are high in fiber. So when you eat lots of fiber, it changes the gut flora into good, positive, healthy bugs. And when you eat processed foods, it doesn't.
What is one thing that's really exciting for you right now in your life?
What's most exciting for me is my babies. My babies are my greatest joy, and they are doing super well, and I'm just happy to be around them and know them. And they are truly the greatest gift I have. And being with my husband, those are the great things that give me joy. Oh, the things that I'm excited about with my work are I continue to build and try to answer the questions of health and nutrition, and asking and being able to be in this space and having become ironically an expert in a field that I just wanted to know because I wanted to heal my body has become such an interesting change of course. But the fact that I can now get to ask all the questions that I want to know, and I get to ask them in a science way and do the research. And then when I do the research, I get to publish on it, and then I get to look at food and understand food quality. I mean, and then I get to teach the next generation of doctors. I think that is pretty exciting.
What is one habit, hack, or tip, or another way that helps you stay on track with your plant-based diet?
I think everybody has moments of weakness where I want to have a chocolate chip cookie or eat refined foods, or just because I want to have it. And people always say, well, how do you do things so perfectly? I don't. I am imperfect, and we're all imperfect. And the human person, the human by nature is a flawed individual. And so I make mistakes all the time. But I think that I always remember, for me, is like, I just never want to be sick like I was. I mean, that was a very difficult time. And I want to be around for my babies. And for me, everything is about that one fundamental thing. And so if I just remember that, the answer is very clear. There is no debate when it comes to, well, these are things I have to do to stay healthy so I can be around, and so be it. It's not really become anymore. It's no longer something I feel I've given up. When I was maybe just starting out, I thought, gosh, everything's being taken away from me. And the irony of that is that everything was being given back. And I became so much healthier and stronger because of the choices I made. And I never want to give that up again. And, I've told people before, somebody actually made me a T-shirt, because I said one time I would eat dirt if I knew that it was healthy and good for me. I don't care, because I would do whatever I had to do to stay healthy and be around for my kids.
What cookbook, book, or documentary have you gifted to someone or recommended to someone transitioning to a plant-based diet?
Well, I tell you that that's a tricky question for me because I'm biased. So I give people, often I give people my book, Body on Fire. I often tell people you don't have to buy it. You can just get it at the library, and it's in most libraries. And if it's not, then tell your library to get it. because it really just talks about the birth of inflammation, which is not what many of the books that are out there right now just don't talk about that fundamental concept, which is probably I think the pivotal thing to understand illness. We also have a cookbook that came out recently called Body on Fire Cookbook, which has some really easy, simple recipes, very Aggarwal style, simple recipes. I like that a lot. I like Will Bolshevik's book, Fiber Fueled. So those are kind of some of the things I recommend to people, but I don't always recommend food books. I recommend meditation books. I recommend calming books. I mean, everybody needs something different. I think it's important to understand that not everybody will heal. I have many patients that are plant-based that they're not totally healed. And I think it's important to remember that there's so many things that can hurt a person, and that every person has to be discussed with individually, all the issues.
What is it about healing that makes you so passionate?
Well, I don't want to be sick. I don't like the feeling of being sick. And I don't wish that on anybody.
Finally, can you give me one word to describe how you felt before you were vegan, and one word to describe how you are now that you are vegan?
I think the word that I would use from before I was vegan was maybe the saying I would say is, what you don't know doesn't hurt you. It would be the way I would say it ahead of time, is you just don't know that things are a problem. And then for now, I would just say that I guess I know a little bit more. I don't think that I know it all. I don't think that I think I'm just starting to climb up the hill one step forward every day. But every day there's something more to learn.
Such a pleasure speaking with you. Thank you so much for taking the time. What is the best way for people to follow you and get in touch with you, either on Instagram or social media or the web in general?
Yeah, so thank you for asking. So I have a website, drmonicaggarwal.com. A lot of people reach out to me through that. I'm better at social media because I have somebody to help me with that. So I use Instagram, and it's Dr. Monica Aggarwal. Twitter, I use all three of these social media, and Facebook. Many of my patients are in a private group where they can kind of support each other, which has been really fun and nice. So these are the sort of venues that are the best way to reach out with questions. And if you want an appointment, reaching out on the website is the best way to do that.
Thanks again, Monica, for being on Plant Your Seed.
Oh, it's my pleasure. It's nice to always move forward the message. So I appreciate what you do and the hard work you put in by doing the podcast, and anything that moves the initiative of focusing on your health through different modalities is very important to me.
Hope you are inspired by this story, and remember, it's never too late to plant your seed. Links to everything we talked about on the podcast can be found on Instagram at plant.yourseed in the show notes tab in the bio. If you enjoyed the show, remember to leave us a review, and until next time, thank you for listening.